Thank you, John. Such a pleasure to be here. Really amazing, an adventure for me to come here in a room where I know less than anybody else sitting in this room, a place where I truly do not belong. When I hear John Hockenberry say, does the dialysis population like to aggregate collectively? I know that I'm at an event that I will never be invited to again, and so it's a pleasure to be here. I'm too old to be transformed, so I'm irrelevant from the very beginning. Innovation, I'm very wary of. To put healthcare and designer in one sentence makes me uneasy. I don't go to designers for healthcare, I go to doctors and nurses. To me, designers are men who wear shirts with broad stripes in colors that I would not wear, and who wear moccasins and spend much too much time on their hair. So I am here as a throwback. I am here as a skeptic. I am here as a recovering 70-year-old person, and I am here because Mayo Clinic invited me to come, and I'm so glad that I turned down their offer to pay me to come. To come as a volunteer leaves you free to have a good time. And so John Hockenberry is not going to come out here and ask me a bunch of questions about the dialysis population here, because I can outrun John Hockenberry. I can avoid him. I first came to the Mayo Clinic in the summer of 2001 because I was wheezing, doing a Prairie Home Companion, getting on and off stage, because, as it turned out, I had sprung a leak in my mitral valve. So I came to Mayo, and it took the internist about 5 minutes to make the diagnosis, and the choice was pretty simple. Either Dr. Orsolak will operate and sew up your mitral valve, or else you will sit in a sunny corner of your kitchen and wait for God to harvest his flowers. So I met Dr. Orsolak that day. He was kind of a short, slight man. He had kind of wavy, dark hair. Orsolak, not from my people, but he came from Pittsburgh, which spoke well for him. He was wearing a pink button-down shirt. When you meet the surgeon who's going to put his fingers inside a vital organ, you remember these things, what he looked like. And I remember that he wore black shoes with tassels, and I've always been suspicious of tassels. But he told me that he was a fly fisherman and that he tied his own flies. So I wasn't about to interview the entire surgical staff at Mayo Clinic. So it was all set up. It was a problem which had been noticed, I should say, by Dr. Frank Mork of the Mork Clinic in Anoka, Minnesota, in 1955, when I wanted to go out for 7th grade football and went in for a physical exam, and Dr. Mork heard a click in my heart and would not sign the form, so I could not play football with all of my friends, and instead I walked down 2nd Avenue from the Mork Clinic, and I walked into the door of the Anoka Herald, whose editor, Warren Feist, had a big roll-top desk just inside the front window where they were selling wedding announcements and so forth. and I asked him for a job. I was 13 years old. I could smell the hot lead of the linotype machine. I could feel the rumble of the rotary press in the basement, and I could smell the liquor on his breath. And to me, it was all a romantic world. He gave me a job covering football, and I wrote about football and then basketball for $1.50 per game, $2 for an away game. And life took a different direction. Some luck lies not in getting what you want, but getting what you have, which once you have it, you may be lucky enough to realize is what you would have wanted had you known. In other words, thank God for failure. Thank goodness for the jobs we were not hired for and the people who did not want to be our friends. That's how we arrived here. So Mayo, July 2001. I had been working hard to get onto an operating table for years. I was an English major, so I set out to be a serious American writer. And at the time, all serious American writers were alcoholics and chain smokers as well. And everybody in the English department at the University of Minnesota was proudly, openly, deeply alcoholic. If you went to an English department party and you did not get drunk, you were thought to be possibly a Mormon, and it was embarrassing. My great hero, James Wright, had a hangover every morning in Falwell Hall, the classrooms filled with cigarette smoke, little tuna fish cans for ashtrays as he lectured about Dickens and so on. He died at the age of 57 of throat cancer. He was a great American poet, and I assumed that to be a great writer, you would need to learn how to drink in a manly way, which is what writers did. And writers did not jog back in the day. It would have been hard to keep a cigarette lit as you were doing it. So that was what you thought. Writers were seriously screwed up, self-destructive people. And when you saw one give a reading who was blind drunk and his speech slurred as he was reading immortal lines that he had written, it occurred to you that his genius and his self-destructiveness were tied together, and it was as impossible for him to rid himself of one as to overcome the other. I got over this. I worked hard at it for 20 years, and then I decided I was not going to be a great American writer, and so I put all of that aside. But I came here to Mayo as somebody who had at one time been resolute about not taking care of himself. The operation turned out well, so far, but besides repairing the mitral valve, it also gave me an experience. It gave me a crucial experience, the kindness of extremely competent people. You are brought into the operating room. You are naked. You have been shaved in embarrassing ways. You are wrapped in a sheet. They lift you up off the gurney onto this glass and steel table in this dim, very chilly room, strange lights and masked people. It's out of a science fiction movie. You are laid down there, and they adjust you. And in this unreal world, to have another human being touch you with some feeling, just put a hand on your bare shoulder, means the world. To know that we are people. You're a person, I'm a person. You recognize that I am. And someone asks you, how are you doing? And means it. It means the world to you. The humanity the humanity, the kindness, the way in which things are done. And then you disappear into the fog, and then the fog breaks hours later, and you find yourself in a recovery room, and these angelic beings appear out of the mist, and they speak with Minnesota accents, and they remove this 12-inch drainage pipe from your mouth, and they tell you that you are alive, and you are grateful for that. And 11 years later, I still am. This is an amazing experience for an adult person to have, to experience enormous competence and kindness, all wrapped up in one piece. It's the thing I most love about the Mayo Clinic, is that it has international expertise and it has small-town manners in my own experience with the place. I came back, I've come back a few times, and I've had that very same experience of humanity in this place. The ear is very attuned to other voices, and we can discern sincerity and humanity in the voices of other people. There's no doubt in my mind about this. We can hear it. We can discern going into the fast food restaurant. We can discern that voice of the clerk, and we know that that's company training, and that's not really her. That's company training. And we feel sorry for her to be overworked and underpaid, and to be denied the basic human right to be grumpy is an infringement of your dignity. But when I came out of that operation and lay there, I was grateful. I was also grateful to be in Rochester, Minnesota, an hour and a half away from friends and loved ones who might have come to see me, so that I could lie in St. Mary's Hospital, and I could be among cheerful nurses, rather than see the pity or alarm in the eyes of my friends as they came through the door, and to have to feel their own fear of hospitals and their own fear of mortality. I never thought about mortality at Mayo. It never occurred to me. Maybe once, but not more than that. I've been to other places. I've been for minor surgery at a clinic on the Upper East Side of Manhattan. Park Avenue surgeon, very highly recommended, a fine man, but here you are in this chop shop and crowded with people, and you're being wheeled around like a bag of fertilizer, and you get the sense from the people who are working there, most of whom you can't understand, you get the sense that they were hired in order to keep costs low and keep the profit margin high. And it occurs to you as you are being wheeled in for minor elective surgery, it occurs to you, I could die here. I could. For my own vanity, I could die. It never occurred to me. Never occurred to me at Mayo. I took my daughter for a time to a large, successful pediatric practice in St. Paul, where you sit in an enormous waiting room that is packed with people, and your wait may be 15, 20, 30 minutes, maybe 45 minutes, and the apologies are not sincere, and you go in to see the doctor. The doctor's very efficient, but having waited so long and all the other people still waiting out there, you hesitate to ask this great man any questions whatsoever. You just shoot on through, and then you realize on your way home that when your wife asks you, what did the doctor say, you have nothing to tell her. It's a bad position to be in. When my daughter needed her tonsils removed, I brought her down to the Mayo Clinic, and it was kindness and humanity. Again, woman surgeon, fine surgeon. I was the Judas who wheeled my daughter down the long hall into the operating room and held her hand as Judas would, and I was the one who took the little clear plastic mask that smelled of raspberry and put it over her face. And when she came out of anesthesia and was wheeled by me, she looked up at me and she stuck her tongue out, and it was sincere. She really meant it. But in behalf of our children, we are seeking humanity in this world, in their behalf. The question in the back of a parent's mind is, if I'm hit by a bus, what will happen to this child? Will this child survive? Will this child be supported and lifted up in this world? Or will this child be crushed underfoot? Especially for the elderly parent of a 14-year-old, you ask that question all the time. On Sunday, I did a painful thing in behalf of my child, and I left her at a boarding school in upstate New York, which is the most painful thing I have experienced in my life, to hold your sobbing child in your arms who is telling you how much she will miss you, and you hold her in your arms and you do not allow yourself to cry, though you know you will as soon as you get free. You hold her in your arms, and then a math teacher named Miss Showell, who I had never met before, came and stood by us, and I took my daughter's arms and I put them around this woman teacher, and I kissed her on the back of, not Miss Shaw, but my daughter. I kissed her on the back of her head, and I told her, whatever else you do, don't scratch your butt and don't fart. And she laughed, and on that little laughter, I made my exit, and I got in my car and I drove down to the city, and I got on a plane, my wife and I, and we flew back feeling bereft. But people do this in behalf of their children. I didn't put her in a boarding school so she could get into Yale. My daughter has serious learning disabilities, and there is no such thing as special education where I live in Minnesota. None. It's a charade. It doesn't exist. They take people like my child and they put them in big windowless rooms, and they give them whatever they need to give them to amuse them, and the teachers are guards at the door. You would not do this to your child unless you had no alternative. I do so. I did this painful thing. I'll never get over it, but it's the right thing for her. She's recovering today. The father is still shaken. But I believe in this idea of humanity in the midst of trouble. We believe in this in the Midwest. To us, one of the crucial aspects of humanity is cheerfulness, and a sense of optimism in the face of dreadful odds. To be cheerful is something you can choose. You can't choose to be happy. Happiness is something that happens out of the blue, like when Minnesota defeats Michigan. It's not a frequent thing. And when it is, you savor it, understanding it's not going to happen again for a long time. Joy, I don't know. It's a theological concept. I have no experience with that. Contentment, belongs to more primitive peoples, the Inuit or the Micmacs or Basque shepherds, but it's not for me and my people. But cheerfulness is the decision that you make to avoid narcissism, to avoid self-absorption, to think about other people, and to have a sense of humor. Courage in the face of dark odds. Humanity is what we need. In the midst of all of this marvelous technology, you go in for an MRI and you are entering a world of science fiction. You go into this sound-locked room, this barricaded room, and they lay you on a platform, on a rail, which is about the size of a coffin, and they hand you this little button you can press in an emergency. You vow you will not press it, you will not press it. And they give you little things to put in your ears and a little blindfold if you choose. You do choose. If you are ever, absolutely choose the blindfold. If they offer you a cigarette, yes, do that too, but the blindfold you will want, and they run you up the rail and into the cyclotron, into the great maw of the beast, your head, maybe your shoulders, maybe more of you, all into the cyclotron, and you have this little buds in your ears, and you hear the voice of a woman in the glass booth. You can't exactly see her in the little mirror there, but she's in there, and you fasten onto the voice of that woman as she tells you that now you're going to hear 8 minutes of buzzing, and then there'll be some dinging, and there'll be some grinding, and there'll be some horrible scraping sounds. You'll hear 5 minutes now, and this is going to take about 35 minutes. And you close your eyes, and you take a deep breath, and you can hear in her voice, you absolutely can hear whether she realizes you are a person in there, or are you a bag of alfalfa? You can tell her humanity and yours coming through your ears, and it makes all the difference in the world. You lie there, and if you've not experienced the panic of claustrophobia before, here's your opportunity. You are dependent absolutely on her. You're not going to press the button. You're going to listen to her voice. You're not going to try to keep time. It's dreadful. Panic is coming to the surface. You keep it down. You are not the first person to have gone through this. You tell yourself that. You're not this is not about you. Be cheerful. She's doing you a favor. Cheerfulness. My people were cheerful people. They were children of the Great Depression. They sat around oilcloth covered tables and they told stories to each other, and they did not appreciate complainers. The stories were supposed to be upbeat, and they were supposed to be about the future. We've all failed. Don't go back over it. Don't relive it. Don't talk about betrayals and your terrible losses and so don't relive the dark parts of your life. Look forward. Help the others. Support the others. They all got old. They all experienced backaches, and they had delicate stomachs, and they walked very carefully upstairs, and they held onto railings, and they felt shortness of breath and all sorts of symptoms, but they did not share these with each other. They were cheerful. This is carried on by our fellow humans in the healthcare system. Whatever can be designed about it, whatever the structure of it is still run by human beings, thank God. And that's who you look for when you go in for health care. as my 97-year-old mother lay dying at home a month ago, the hospice nurse who came out to check on her spoke to my mother as one person speaking to another, telling her what she was now doing, what she was putting this thing up to my mother's chest for, even though my mother showed no signs of responsiveness whatsoever. Still, she was treated as a person as she lay there dying, and it meant the world to us. When I came down to Mayo for my prostate biopsy, what those two men did for me, aside from telling me that I don't have prostate cancer, thank you, what they did for me was to show me something I'll never forget. It's an embarrassing thing. It's uncomfortable. As the doctor's assistant said, it's like having 9 hornets up your butt. But they went at it like a vaudeville team, like an old comedy team. The Russian urologist and his assistant. And the jokes were almost funny. And the conversation and the byplay, and now we've got 4 more to go, and now we've got 3 more, and now 2 and 1, and now you're done. And when you were done, you shook hands with them, and you said thank you, and you meant it. You meant this. Aside from its medical value, this was such an experience of civility, competence, great competence, put at your service, you, by people who recognized your humanity preserved even under these awkward circumstances, the delicacy of people who do colonoscopies, the matter-of-factness of the man who gives you your urine flow test. These are precious things, and they are valued by us. We come from cheerful people, stoical people. We know that on this anniversary of that day back in 2001. I was in New York. Disaster strikes, and we are stunned. And then we get up and we go to work. It happens over and over again. People feel a need to be angry, and now for the next 6 weeks, we'll hear a lot of anger, but in the end, it's not crucial. It's not crucial. It'll pass. It's all about less important things. It'll pass. Real anger is when men on horseback ride into town and machine gun people, and that doesn't happen much in this part of the world anymore. It used to, but it doesn't anymore. So we're lucky. We have reason to be cheerful. And for that reason, I've decided that when it comes time for me to die, I am going to come back to Rochester and have Mayo put me someplace. And there will be cheerful women there. There will be large, cheerful women. And they will walk into the room, and they will say, well, it looks like it's going to clear up after all. And then something else will happen. All right, I have not solved the problems of the dialysis population in the aggregate or individually. But thank you so much for inviting me. Thank you.